Good morning, this is Randy Baxter, nurse practitioner at Powell Valley Healthcare. We're here to talk about the respiratory clinic and our collaboration with Heritage Health.
Hi, I'm Wendy McAndrews and I'm here today representing Heritage Health. And as Randy was talking about, we are collaborating with Powell Valley Healthcare and their respiratory clinic. So our patients at Heritage Health can come over and be screened with us. They call in and we ask some questions and give them direction. And if they need further assistance, we've worked it out so that they can continue with the respiratory screening clinic here at Powell Valley Healthcare. So remember, Heritage Health patients, if you have a need, call Heritage Health at 307-764-4107. And from there, we'll screen you and help you with any healthcare needs.
For all community residents, if you are concerned about COVID or any other respiratory illness, you can call the COVID hotline at 754-1242. A nurse will triage you. If you screen positive for a respiratory illness, we will offer you an appointment time either at your earliest convenience or at an available time.
Don't forget us, Heritage Health and Powell Valley Health Center, here to help you with all of your needs. Thanks.
Once you're on our schedule at the respiratory clinic, one of the staff members will come greet you at the door. We have the doors locked because we do not use our waiting room because there's no way to keep social distancing. As you can see, the door is locked, so you'll either call the number that's 754-1202 or just knock on the door. Our scheduler will come out dressed in the proper PPE, and we'll provide you a mask from there. You'll wear the mask the entire visit, and all the staff will wear their personal protective equipment as well. Once they come get you,
Give you a mask.
and this is the kind of mask that we'll have you wear. Once we come get you, we'll bring you into our waiting room. There'll never be more than one patient in there at a time. Bethany is working today. She's one of our schedulers. It may be a different one, but they'll take your information, check you in, and then have you seated, hopefully for not very long. And then one of the nurses or MAs will come get you. What else? When it's your time to go back to the appointment, the MA will come and say your name and bring you on back through this hallway. With our process, we never have more than one patient in the hallway at a time. This here is the nursing station. Behind her is where we keep all of our personal protective equipment that we'll put on before your appointment. There's hand sanitizers on almost every single wall in here, so please feel free to use that as much as possible. This room here is where we do all of our point of care testing, like rapid strep. We also have supplies to do COVID testing as well. And back here, we have potentially 4 rooms we can have patients, but we like to have a flow where we only have 1, at most 2 patients in the clinic at one time. In this room, the nurse will bring you in. She'll check your vitals. She'll ask you a bunch of questions and then have you sit in one of these black chairs waiting for the provider. I'm one of 3 providers that circulate through this respiratory clinic. The other 2 are Mark Wurzel and Dar Hauser. During your visit, we will examine you, evaluating for any kind of respiratory illness. We'll deal with whatever we see. With regards to COVID testing, the state has certain priority requirements for testing, so not everyone will get tested. Currently, there are 6 criteria that need to be met for us to send samples to their lab. And if you don't meet one of those, they could either put you down at the bottom of the priority list or they could kick out the test altogether. If we think that you may have COVID or there's a good chance, we can offer to send it to another reference lab like Quest or Mayo Clinic. There are costs associated with that, however, whereas if it goes to the state, it's free to you. Currently, We have had no positive cases of COVID. In this last week, I know that we've tested about 10 or so. So far, they're all negative. Once your visit is over, we'll have you walk down this hallway and then exit out the back door. And we'll call you with the results on all your testing, whether it's COVID or influenza or whatever we test for. We've done a lot of tests in this facility, and so far we've been very fortunate in this area to not have any positive tests. So remember to continue doing your part to reduce our risk by washing your hands frequently, do not cough into your hands, and practice social distancing. Another thing to think about is you may carry it, so please stay away from people that are vulnerable. Those are those older than the age of 65 and those with chronic conditions like diabetes and COPD.
And be sure to take care of your mental health. As a behavioral health provider, it's important to make sure that you're exercising, that you're eating well, that you're talking to people. If you need to do that about any stressors or struggles that you're having. So be sure to provide for your mental health and your children.